Hi there, everybody. I'm Melissa Russo, and we are here today to talk about an issue that is newly of concern to parents throughout our area here in New York and now in New Jersey. There's a good deal of concern about this. It's a serious syndrome that is sending children to emergency rooms throughout our area. It's believed to be from COVID-19, and it's now impacting scores of children in our area. Governor Cuomo, just within the past hour, has announced that at least one child has died from this. We can tell you it was a 5-year-old boy. He died last night at Mount Sinai Hospital. And we are aware of a second death in Westchester now. So this is, of course, troubling news, but we want to keep this all in perspective. And to help us do that, we're joined by Dr. Stephen Kearney, who runs the pediatric critical care unit at Morgan Stanley Children's Hospital in Upper Manhattan. He's been seeing these cases firsthand, and he's taken some precious time from his busy schedule to join us here today and answer questions we've been getting from parents. Dr. Kearney, thank you so much for being with us.
Sure. Thank you for having me, Melissa.
It's our pleasure. And I think parents are really interested in this issue. Of course, the news from Governor Cuomo today is very troubling. Is this the first that you've heard of a child dying from this particular wave of cases that we're seeing now?
Yes, it is. It's news to me as well.
Tell us when you first started to notice that this was a thing in your hospital and at other hospitals. What were you observing in children, with an eye toward what parents should be thinking about in terms of symptoms?
Well, it was a couple of weeks ago that we saw the first really case or two of these kids who come in. Interestingly, we kind of associate COVID disease with a lot of respiratory distress, and that's certainly what we've seen in the adult population, where they have bad pneumonia and need oxygen and sometimes a ventilator. These kids are presenting differently. So by and large, they're not having trouble breathing, and they're not their oxygen levels aren't low, but they have had fever for several days. They tend to have a very impressive rash that can oftentimes be all over the body. They look sick. They clearly, they haven't been eating. They have some GI symptoms, either vomiting or diarrhea. And when they come to the emergency room, the most sick ones have been in what we call shock. Their heart rate's very high and their blood pressure's low. And so we have to give them IV fluids and medications to help reverse that.
And you've told me previously that you've seen between 15 to 20 of these cases roughly. Is that number continuing to go up? A couple of days ago, you told me you were still getting 1 or 2 cases a day into your hospital.
Yes, and we're getting them every day. So yeah, the numbers have gone up and continue to go up. We haven't been, it's been kind of a steady number over the last couple of weeks. We haven't yet at least seen a huge spike, but we're still early and we don't really know what might be coming.
Now, it's been a little slow for the word to get out about this. We first reported on a number of cases in the New York City area back on April 28th. And since then, city and state health departments have put out an alert to hospitals like yours asking for more information so that we can get a bigger picture sense of the scope of all of this. Some part of the reason to get the word out about this is that not only so that parents can be mindful of symptoms, but so that pediatricians can learn to recognize this when parents call them. You may be very accustomed to seeing these symptoms, but local pediatricians may not necessarily know that this is COVID related. Are you still seeing cases where initially pediatricians weren't sure how to treat this or weren't sure that it was necessary to send children to the emergency room right away?
Well, the good thing is pediatricians are extremely well trained in identifying sick children. And so certainly the children we're seeing and the children that come to the ICU, they appear sick. So even though you don't know exactly what's going on, they appear sick in the same way kids always appear sick. The kind of recognition piece that you're alluding to is largely because most of these kids, more than half, are testing negative for COVID disease, for the virus, meaning, the COVID testing that most people think about is that nasal swab that looks for RNA that's present in the virus. And the way that we have been diagnosing that with the majority of the kids who don't have a positive COVID test is to look for antibodies, to look if they've been exposed to the infection at some point in the past. And so far, every kid that we've taken care of, if they don't have a positive primary COVID test, they all have evidence of COVID antibodies, meaning that at some point, 2 to 6 weeks before that, they were exposed to the virus.
And so let's talk about what that means. They're not presenting the way adults are presenting with the respiratory symptoms and the pneumonia. But what ends up happening is that you're presuming they have had the virus already, and that what they're getting sick with now is it accurate to say an overactive immune response that develops several weeks after they've been sick with COVID, but asymptomatically so?
Yes, no, that's exactly how we describe it. It's an inflammatory syndrome that's associated with inflammation that is probably set up by the COVID virus, and those things we see like fever and rash and low blood pressure, those are all very classic things that we see when what we call cytokines are released, which are inflammatory mediators that cause all of those things.
I'm going to go straight to some of the questions we're getting from parents because they address some of what you're talking about. Our first one from a mom: do the majority of the cases coming in have extremely high fevers, or can they also have mild fevers?
The cases we're seeing all have, I call them pretty high fevers. So usually kind of 102, 103. We have seen some kids with fevers higher than that, like up to 104 or 105. Certainly not higher than that, which is what I would call extremely high. What we have not seen are kids with kind of low grade temperatures, like around 100 or 101. Okay.
Another question. My child was diagnosed with Kawasaki disease, and we know that this is a disease that you'll explain better than I will, but it's the symptoms that are presenting now have been described as Kawasaki-like, but not necessarily Kawasaki disease itself. But here's what this mom is asking. My child was diagnosed with Kawasaki disease a few weeks ago and was swabbed for COVID-19 at the hospital, but it was negative. Is there a need to test my child for antibodies if he's already being treated for Kawasaki disease?
It's an excellent question. So you can still develop, obviously, Kawasaki disease in the absence of COVID. The timing of this for this child sounds like it could be related to COVID infection. I suspect this child was treated like he or she had Kawasaki disease, and if that's the case, there's not really a reason there's no reason to get antibody testing that would change any treatment. There might be a reason in the future to see if this is in fact due to COVID disease. And I would encourage that, but there's no hurry for it, and it wouldn't change any treatment.
Okay. Question from Samantha Burris. Should children be getting vaccinations right now? Because there are ingredients in some of the vaccinations to break down the immune system so that the shot is effective. Is this too risky right now with the COVID-19 out there?
I don't think so at all. I think what we're learning from COVID is that vaccinations are more important than ever. And there's no reason about what's going on now to suggest that those should be delayed for any reason.
Okay. Question from Spressa Hopper in Manhattan. What are the first signs that should be a red flag for parents? And how do the numbers of children with COVID-19 to date compare with the numbers of children with the regular flu?
That's a really interesting question. So to take the first part of your question, which I think was about, the second part of your question was how many children have COVID compared to how many have the regular flu. What was the first part of the question again?
What are the first signs that should be a red flag for parents?
Yeah, the first signs are the things I talked about, high fever, high heart rate, just looking sick, inability to eat, vomiting, things like that, the things that we have talked about. We really have no idea how many children have had exposure to the COVID virus and COVID disease. And the reason for that is, even though we know that in the New York area anyway, there are well over 200,000 people who have tested positive for COVID infection. I can tell you very few of those are children. And the reason that very few have tested positive for children is because we haven't tested many children. And the reason why we haven't tested many children is because we have really prioritized testing for those who are sick. And we know that children don't get sick from primary COVID infection. So we can only extrapolate that, and I suspect that many hundreds of thousands of children have had COVID infection that has been essentially asymptomatic or had very mild symptoms, but they haven't been tested. There was no reason to test them. So I can't compare that to flu numbers. I suspect far, far more children have had COVID than have had flu, because we know far more adults have had COVID than have had flu.
But now that we know that children, some number of them at least, are getting sick from a secondary COVID infection, does that change, in your opinion, whether or not children should be more routinely tested for COVID-19?
Well, so just to clarify, Melissa, it's not a secondary COVID infection. So they're only infected once, but this is a reaction to that infection. It's just a delayed reaction. And so, no, I would say there is.
I have a medical degree and I do not.
Yeah, no. It's just a clarification that I do think is important, because it's not a reinfection with the virus. It's a response to the virus from an infection that happened at least 2 weeks ago, and probably longer. And so there's no reason for children to get tested for primary COVID disease. I do believe that if they're symptomatic and requiring treatment, like the kids we've seen at our hospital, then yes, they should be treated for both COVID infection as well as antibody testing.
So another question that's sort of related to what we're talking about, is the regular flu more dangerous for children than COVID? Is it too early to know? And then I would add to that the question of, do we also see any of this multi-system inflammatory type syndrome in children who just get the regular flu?
So yeah, a lot of elements to that question. So it does seem like the kids who get the flu get sicker than kids who get primary COVID infection. That does seem to be the case, because we haven't really seen kids get very sick from the flu. And I can tell you, our ICU before COVID started had lots of kids in it who had the flu. But we haven't had many kids in it who have had COVID infection. So in children, for reasons we don't understand, primary COVID infection doesn't seem very bad. So, and it doesn't seem as bad as the flu. Now, the secondary thing we're seeing, we see something like that very rarely in reaction to many different viruses. I can't tell you about the flu in particular, but there are lots of immune reactions to the flu, things like myocarditis and other kinds of things that are felt to be secondary to a kind of an overactive inflammation that happens with many viruses. So I think one of the reasons we're seeing it now is because, at least I believe, so many children were exposed to the COVID virus that now, even though I still believe it's a rare complication of COVID infection, when you have something rare that occurs in many tens of thousands of children, some of them are going to, show up at your hospital.
I know you said that they're showing up at your hospital in a sort of steady stream, a couple a day or so, and it doesn't seem to be spiking, which of course is a good thing. Lauren Larson sent a question to us asking whether the trend line of cases of, she's calling it Kawasaki, in the US and Europe suggests that more children will get sick, or that those numbers will go up. Do you know anything about that?
Well, what we do know, and I have talked to colleagues really all over the world about what they're seeing, and there's a couple interesting things about that. Number one, this is not something that was described a lot in China or the other East Asian countries, and described only a little bit on the West Coast of the United States. It does appear that the virus that kind of the variant of the virus that we're seeing in Western Europe, as well as in the New York area and Eastern United States, is a little bit different from the virus there. And it seems to be these areas, meaning Western Europe and the eastern part of the United States, where we're seeing this hyperinflammatory syndrome. So there have been, the first cases reported of it were from the UK, and there was a report that just came out this week about cases they've seen there. And talking to colleagues, they clearly were seeing it there and in Madrid, as well as Italy, before we were seeing it. And we believe it's just following where the virus has occurred first.
Okay, I'm seeing a question that I think if this one mom is asking this question, I'm guessing that other people have the same question. Is this as contagious as COVID? And what I think the questioner is asking is whether this is contagious. And my guess is no, but can you make that point for us, since I'm sure other people must
So
also be wondering
you do know something about this, Melissa. So yeah, no, that's exactly right. There's no reason to believe that this is contagious at all. And the reason for that is because, and interestingly, some of the evidence for that is that we're not seeing it like in siblings. It seems to be in families with many children, one child may be affected, but the others are not. And we know that probably all of those children were exposed to the COVID virus. So no, there's no reason to think that this is contagious.
Okay. Another question. If the 64 cases of illness in New York State, which is unfortunately now up to at least 73 according to the governor, have tested positive for the COVID itself or COVID antibodies, does that suggest that the antibody argument does not mean that one is spared from serious COVID illness?
Well, it's
that antibody argument may be meaning that if you have antibodies, you're not going to get sick. In adults, we think maybe that hopefully means we might not get sick from the primary COVID,
right.
But children, it's something that's developing later.
Right. We do believe, but we don't know this for sure, that essentially everybody who is exposed to the COVID virus develops COVID antibodies. For most diseases, that means that those are protective antibodies, so that if you get exposed to that infection again, your antibodies will protect you from getting sick. We don't know enough about COVID to know whether that's true, meaning whether those antibodies that we know essentially everybody generates are protective for the COVID virus. We believe and we hope that they probably are, but those studies are being done about how effective those antibodies are at protecting from subsequent infections. Now, this particular illness, we don't believe that having this will affect your ability to mount an immune response to the COVID virus if you're exposed to it again. We think this, and what our experience so far has been, is that this seems to be a temporary kind of hyperinflammatory picture that either with medication for severe cases or just with careful observation and support in the less severe cases, we know it gets better.
Talk to us about how you do treat it, and are most children making a full recovery?
So the way we've been treating it is essentially with what we call supportive care, meaning if they're very sick and they need to come to the ICU, we give them IV fluids. You may need to give them a little extra, keep their blood pressure up. And in some cases, we have to give them medications to keep their blood pressure up, to let their heart work a little more efficiently until they start to recover. If they are severe, sometimes we will also give steroids, because we know steroids are anti-inflammatories, and the children that we've given those to have responded very well. And in some cases, going back to that Kawasaki question, we know that the treatment for preventing the severe complications of Kawasaki disease are with something called intravenous immunoglobulin, IVIG, people call it. And we do give some of the children that if they meet the criteria for Kawasaki disease, which some of them do.
I've also heard some examples from some of your counterparts at other local hospitals that some children have had to be put on a machine that helps their heart.
So there are different kinds of machines that do that. I haven't heard of anybody going on what we call ECMO, which is basically heart-lung bypass machine.
Mm-hmm.
I haven't heard about those cases. We haven't had cases like that. It's certainly possible.
Parent is asking, how do we protect our children from this horrible version of COVID, as the parent puts it? And as counties and states open up, would you anticipate more cases of children with COVID-related inflammatory disease?
There's honestly nothing you can do in terms of whether a child develops it or not. You can reassure yourself that it's a very rare complication as far as we can tell, and the vast majority of children who have been infected with the COVID virus aren't going to develop this. The only way it might increase is if we have an increase in the number of infections of people with the COVID virus. Fortunately, in the New York area, we're seeing quite a decrease in infections. But as I think everybody is aware, as the social distancing measures are relaxed and business gets back to normal, we do expect that there might be an uptick of infection. And if there is an uptick of infection, then I would expect at some point we would see an uptick in this as well.
Is it fair to say that there's a different level of concern now that we're seeing more of these cases in children, that the social distancing relaxations and our planning for reopening schools and talking about summer camp and all of that could be impacted by this?
It could, we believe it's still early in this. We also believe it's still a very rare complication. So in the grand scheme of COVID disease, we think this is going to be a very small piece of it. We are still reassured by the fact that surprisingly, kids really don't get sick from the primary COVID infection. And somebody had brought up that question about the flu. They don't get at all as sick as they do with the flu. And that part's been reassuring.
One of the things I've also heard is that time is of the essence in terms of treating these children. And I assume that they would be, if as days would go on, they would become sick enough that most parents would certainly seek medical attention. But I've heard that it's important to treat these cases within the first 10 days or so to avoid lasting heart damage. Is that true? And can you talk us through that?
That we know that that's true in Kawasaki disease. So in Kawasaki disease, which as we talked about has some overlapping kind of symptoms with what we're seeing here, we know that they need to be treated like within the first 10 days or so with IVIG to prevent what we call coronary artery aneurysms, which are an abnormality of the coronary artery that can absolutely be life-threatening. We don't know if that's the case here because, like I said, most of these kids don't fit the exact criteria for Kawasaki disease. So what we are doing is we're making sure everybody gets followed up with a cardiologist to take a look at those coronary arteries. But right now, we aren't really sure how much relationship there is to what we're seeing and what Kawasaki disease is.
Can you tell us a little bit about how you and your fellow medical professionals are collaborating about this and sharing information? And has that process yielded any helpful information in terms of what's working best to help treat these children?
It has. And what I can tell you is that once a week, we get together on a Saturday evening, really with experts all over the world. And it's multidisciplinary, meaning pretty much everybody's a pediatrician, but we have critical care people, rheumatologists, cardiologists, and everybody's sharing both their experience and what they think is going on. Now, interestingly, because we're in New York, and this is where most of the COVID infections in the United States are, we're seeing this both, we're seeing more of it, and we're having to learn to treat it so that we can inform our colleagues. But we have absolutely learned from our colleagues in the UK who have seen this for at least a month or so about what has worked for them.
Does it surprise you, Dr. Kearney, that the city health department last week did not know anything about this development? Is it not the type of thing that someone would have notified the city or state health officials to get them sort of alerting parents and alerting the medical community more quickly? The first time we heard Governor Cuomo raise this at his daily 7-day week news conferences was today.
Well, I didn't know a lot about it a week ago. I can tell you that. And I can also tell you that the first cases that we saw, they weren't COVID disease that we knew because they tested negative for COVID. So a lot of places don't have the ability to do the antibody testing, or they don't have the ability to do it quickly. And it really it became apparent that there's probably a relationship between the two when we, especially for these kids that were testing negative, but then we found out their antibody testing was positive. And really, we only learned about the positive antibody testing at the beginning part of this week and the last part of the end of last week. So it's all been evolving very quickly.
So we know your time is very precious and we're almost out of time. So can you one more time, just in case parents are just looking in now on this conversation, one last time, just tell parents what they need to be looking for. There are a range of symptoms. How can this present, and what is important for them to know?
Sure. This isn't subtle. I think all parents know when their children are sick, and their children will look sick if they get this. They'll have a high fever. They'll have a rash. They won't want to eat. They may be throwing up. They'll be kind of lethargic. They won't feel well. And if they're not feeling well and they're that sick, they need to be seen.
Can you also just talk about the rash that sometimes shows up with this? Because I've heard parents asking, I had this kind of rash, but not that kind of rash. What does the rash look like when it is part of this manifestation?
Yeah, I've kind of avoided talking about that a little bit because it can look like lots of different things. It can be all over the body. It tends to be red, sometimes a little bit swollen, but it can be anywhere, really. When you push on it, it blanches, meaning it's really red, and you push on it and it becomes white. Interestingly, it does seem to affect a couple areas where rashes don't normally affect. So you can have it inside your mouth or around your eye. You can also have it on the palms of your hands and the soles of your feet, which are also unusual locations for rashes to be. So there are some distinctive characteristics about it, but it can really look like just about any kind of rash, though it tends to be much more severe than the typical childhood rash.
And just to reiterate, this multi-system inflammatory syndrome, as it's now being called, is most likely impacting children who had no prior COVID symptoms and children whose parents may never have thought anyone in the family was ever exposed to this, correct?
That has certainly been the situation in many cases. And these, by and large, are previously healthy children. So the kids that we saw get sick with primary COVID disease, by and large, had some pretty serious underlying medical issues. That doesn't seem to be the case here.
So this serious syndrome is now impacting children who you believe overall did not have previous medical conditions that made them vulnerable.
That's correct.
Okay, that's troubling, but at the same time, you're saying you feel that it's relatively rare.
I do believe it's rare, and the presentation isn't subtle, and there are very good treatments for it.
Well, we just want to thank you for all the work you're doing, taking care of these children and sharing your time to help educate our viewers at NBC New York and NBCNewYork.com. And we hope that we'll be able to check back with you because you've been a huge help to us in understanding this new emerging sickness in our children in our area. Thank you, Dr. Kearney. We appreciate it. And thanks
Thank you,
for
Melissa.
joining.
Have a good day.
You too.